All right. Good evening. It is Wednesday, right? Wow, I have had quite the day, and I hope that you guys, you ladies, have had a wonderful day as well. And I'm just gonna I'm just gonna be honest. Today has been a super busy day, and uh, I realized just a little few minutes ago that yeah, I'm kind of spent today, but I think we're going to be able to get through tonight's topic. Just hoping that just wanting to wait till everybody who wants to get on tonight gets on, but um, I'm going to get through it, and it's going to be I think a really important topic. While I get ready to do that, though, I will say my disclaimer that I need to say every time. And so that is this: anything that I say tonight is just health information and not health advice. Do not start taking, stop taking, or change the way you're taking any of your medications. And if you really feel like you need to do that, please consult with your prescribing practitioner so that they can help you make those adjustments and do it safely. And attending this Wellness Wednesday does not establish a doctor-patient relationship. All right. Looks like we probably are good to go to get started. Yeah, sometimes if you can't see the presentation, you need to refresh your page and it's right at the top. So awesome. And everybody can see me and hear me okay? Can I get some thumbs up if you can hear me and see me okay? Awesome. All right. We are good to go. Ladies. No, I don't know what that is. What is that? I hear a bell like something's gone off, but I don't know why. I guess that's it. Great. We're done, right? Bell sounded, we're done. All right, now. Um, Silent infections. That's tonight's topic. Oh, you didn't hear that. Okay, I'm getting a text that nobody heard. It sounded like a school bell going off on my computer, and I guess you didn't hear it. So that's good. All right. Bad joke. Silent infections. All right. So what does the name imply? Right? Infections that are going on in the body that you really don't have any idea. Really, the symptoms don't really any symptoms you might be having don't really make a whole lot of sense for having an infection. Um, what is the significance of silent infections? Well, silent infections, and I'm going to explain what they are and what certainly all the examples, but silent infections will put a strain on your body's immune system, where your body's immune system knows that there's an infection going on, or in some cases, it knows there's something like you're dealing with a toxin, but you're genetically unable to do anything. Your immune system isn't able to actually do anything about it. And that happens in 30% of us. Uh, for any of us, it's a strain on the immune system. And what I mean by that is it's a strain on your body's resources where your immune system will know, that there's an infection and it has to do what it does. It'll make antibodies. It will it will tell certain cells to go after the infection. And so you might need to make more cells, more white blood cells to go after the infection. Um, if your immune system is in good shape, if it's not well, I mean, if it's not in great shape, it may or may not be able to make more white blood cells for you. It will just kind of change the way your white blood cells are differentiating or becoming. So many of you will see in your tests especially the CBC. And I will show you this more of this in the master class. I will go through tests and show you. Um, but you have different kinds of white blood cells, and your immune system will make different kinds of white blood cells depending on what the biggest strain is. Okay. Um, and so it will strain your body's resources because to make to go after those infections, your immune system has to make antibodies or, like I said, new white blood cells. And so the proteins that you need in other areas of your body are used for they're being diverted to make those antibodies and new white blood cells instead of helping you digest your food, or make it would help you make enzymes in your liver, or help you make help certain reactions go in your body to help you function properly. So but most importantly, what these do is they cause inflammation and disease. So hidden infections, silent infections, are a major cause of autoimmunity. They can cause cancers. They can cause Alzheimer's disease. They can cause cardiovascular disease, liver disease, etc. Okay, so this is why these are so important. And sure, you go to the doctor and you're diagnosed with a disease. Well, what's the next step in traditional medicine? Well, they give you a pill, they give you a treatment, a drug, or maybe surgery, right? And unfortunately, sometimes those surgeries aren't always necessary. Um, like gallbladder disease. A lot of times it is necessary, but a lot of times it isn't. Um, Thyroid disease is a good example. Sometimes it's necessary to remove the thyroid. Sometimes it's not. Um, and so forth. So you get my point. It's wouldn't it make more sense to really try to discover what's causing the disease instead of just calling it the disease and treating it first with a drug, right? Or if you have to really get it under control quickly, treat it with a drug, but then find out the causes, right? So hidden or silent infections are the cause of these things. One type of cause, and very commonly can cause these things. Symptoms of hidden infections might be just what you're typically used to having: fatigue, weight gain, brain fog, joint pains, muscle pains, ringing in your ears. Some others might be itching, um, occasional or intermittent gastrointestinal symptoms like heartburn or nausea, or um, intermittent diarrhea, uh, alternating with constipation, um, or just chronic loose stools or chronic constipation. These can be symptoms of hidden infections. Headaches. I mean, the list kind of just goes on and on. Um, but wait, these can be symptoms of low thyroid. Hey, wait, these can be symptoms of adrenal issues. Wait, these can be um, these can cause these issues. These adrenal issues, thyroid issues, gut issues. All right. So silent infections are a major cause of autoimmunity. Um, let's list a few of them. So H. pylori, and I'm going to go through these. I'm going to list them and then I'm going to go through them. H. pylori, candida, hepatitis C, herpes, Epstein-Barr virus, which is a type of herpes virus, parasites, Lyme, Marcons, gut infections, There's certainly there's some other viruses. So these hidden infections are really important. Okay. Um, so let's talk about H. pylori. This is a bacteria that will reside in the stomach, mainly because it likes the lining of the stomach, the mucus lining, and it's there in most of us, but it doesn't turn pathogenic unless there are triggers for that. Um, and then once it's triggered, once it kind of turns on, it changes, then it can start causing ulcers. Okay, it starts causing at least inflammation, like gastritis, and then it can lead to ulcers. So nausea, that can be a symptom. Um, Headaches, it can cause headaches. Uh, and yeah, there are certain tests that test for this. Candida, Candida is a yeast, and it can be in the gut. It can be also in the bladder. Um, you can have it all through your GI tract. I shouldn't just say the gut, but you can have it in the esophagus and stomach, um, where it can be more wide, so it would be more widespread. Um, and and so the candida is a yeast, and one of the reasons why it's such a bad deal is this can manifest in skin conditions, so that can be a symptom. It can cause fatigue because candida or yeasts feed on what we call pyruvate, which is it's when glucose first gets into the cell and it's converted to pyruvate. It's the first step to glucose being used as fuel for making your energy. But if you've got a lot of yeast, then it uses up that pyruvate, um, and then you suffer from fatigue. It's a major cause of fatigue. But like I said, it can also cause skin conditions and so forth. All right, hepatitis C. Now, 50% of those who end up being diagnosed don't even know they have it. And and it's like you'll see certain signs in the laboratory, testing, but you might see just a little bit of an increase in liver enzymes, AST and ALT. Um, Hepatitis C can cause significant liver damage, and so cirrhosis. It can be a leading cause of liver disease and death by liver disease if you have hepatitis C. Um, and these viruses, these hepatitis viruses, there are others, certainly hepatitis B, hepatitis A. Um, they can get turned on and reactivated. Um, the treatments are, I mean, it's difficult. You have to be treated with immunoglobulins um, and so it's very specific types of medications. So they cause liver disease. Well, what happens when you have liver problems? This impacts so many things. This impacts your hormone production, especially during postmenopause. This impacts thyroid function because when you have liver disease and caused by these infections, you're not going to convert your T4 to T3 very well, and then you'll suffer from hypothyroidism. Um, and and this can lead to fatty liver disease because causes liver cells to die, and dying liver cells end up turning into the fat, and that's one cause of fatty liver disease. Okay, herpes viruses, they're everywhere. There's so many of them. They're kind of just a huge virus family, and one of some of them that you might be more familiar with would be like herpes simplex A and simplex B, um, for oral herpes or genital type herpes. And certainly these cause skin issues, cold sores and vesicles. Genital herpes causes vesicles, little tiny, um, well, they're more like blisters, little tiny blisters, um, and burning pain, and it's sexually transmitted and transmitted by just touch, right? When you touch someone with a cold sore, very, very, very contagious. Okay. Um, and herpes remains dormant in your body. And so you bet this is a huge strain on the immune system, because your immune system will, even in the dormant state, it will produce antibodies and use up those resources that your body needs, the proteins, the amino acids and proteins that your body needs. Um, Epstein-Barr virus is a type of herpes, and there are some some about 66 strains of Epstein-Barr virus. Six of these Epstein-Barr virus strains cause mononucleosis. This causes enlarged spleen, can cause a really bad upper respiratory problem, and sore throat, really painful. It can really zap your energy when you have mononucleosis. So, of course, if you have that. Epstein-Barr virus is more of a silent infection and can cause chronic fatigue syndrome. Um, and and you don't necessarily know you have Epstein-Barr virus. You may not have had mono because only 6 of the 66 strains cause it. So here, so many of you would be, especially those of you with autoimmunity, are dealing with like autoimmune Hashimoto's thyroid disease, caused by Epstein-Barr virus. This is a very common cause of Hashimoto's. Um, and and so you just have to test. You have to test for especially reactivation. That makes the most sense. And so um, we've got to look for that too. Parasites. I've done a whole Wellness Wednesday on this. You will need to go back and listen to that to get a ton of details that I gave then on parasites, but certainly they're a silent infection. So many times we just don't. Most of you didn't even know that we deal with parasites so much if you listen to that Wellness Wednesday. Um, and and you bet this is silent, because you can have certain parasites that are intracellular, meaning they're small enough that they go inside the cells and cause damage. They're eating you slowly, and you don't recognize it, other than the fact that you're tired, you have fatigue, you are gaining weight, which you can lose weight with some parasites. It's more obvious, I guess, with some of those, like tapeworms, or, well, those are the main ones that cause weight loss. Most of the time, the rest of the parasites actually cause weight gain. Um, so roundworms, threadworms, which are the microscopic worms, um, and so we've got to recognize that those are a possibility. Lyme, especially for those of you who, the 30% of you who are, and it's going to be more than that, of those of you watching, because um, what I have found is easily 95% of my patients who are sick, who have symptoms, have these genetics that make you susceptible to biotoxins. So Lyme is caused by the bacterial Borrelia. So bacterial infection. It's hidden because these bacteria go into the cells, like burrow into the cells, and your immune system doesn't catch them unless It's right in the beginning, right when you were inoculated by the virus, or excuse me, the bacteria, from a tick bite or a mosquito bite. Um, Anything really that can bite you can give you Lyme. Chronic Lyme, in those of you who have these genetic susceptibilities to biotoxins. Okay, MARCoNS stands for multiple antibiotic resistant coagulase negative staph. Now, you may have sinus symptoms with this, like would go along with an infection. So it's not necessarily a silent infection, but I mean, if you've been taking antibiotics and it never clears up, you have chronic sinus infections or chronic allergy type, a lot of congestion and sinus pressure. It's just never been solved. I mean, maybe they've tried, maybe they've thrown antibiotic after antibiotic at you, and it's just never cleared, or all the allergy medications that they have at you, Allegra, Claritin, um, you know, Loratadine, whatever it is, Benadryl, these, and it just doesn't seem to get any better. Well, they kind of stop and they give up, or they resort to sinus surgery, and in some cases that does something helpful, but um, a lot of times it doesn't. The failure rate of sinus surgery is high. And so, well, they're not checking for this one thing. They're not checking for MARCoNS, this bacteria that forms biofilms and releases neurotoxins, but they're not just neurotoxins, they're endotoxins that cause inflammation of your blood vessels, and this leads to cardiovascular disease. This can lead to a high CRP level. This can certainly be a cause of heart attacks and strokes, and they don't even check for it. They have no idea this exists. So, and then the last silent infection I wanted to talk about is gut infections. And again, you may have some of these symptoms that I mentioned, but they're not like obviously infection symptoms due to infection. Like you're not getting a fever, you're not getting, you know, um, you know, uh, other other infection type symptoms like upper respiratory symptoms, or all you just get maybe is some constipation. Certainly abdominal pain could be a sign or symptom of infection, certainly, but you know, most people that come to see me don't even know that are diagnosed with gut infections after we do the proper testing, don't know they even have a gut infection. So we're talking about a bacterial overgrowth that isn't your typical, like C. diff or, colitis type, infections like diverticulitis or colitis. Um, so it's just important to get the right testing. Um, Most of you, like I said, who are dealing with autoimmune thyroid disease, these infections, you'll have them. They're a constant strain on your immune system, and this causes the problems that Hashimoto's causes. I go over this in detail in the masterclass coming up. Um, so don't miss it. If you haven't registered, please do so for the masterclass. You need the right testing. The right testing is required to see if you have one of these infections, and it's important so that you have one. Therefore, you can treat it, right? Therefore, you can get rid of it and let the body heal. So easily, 70 to 80% of my patients have underlying infections that they had no idea that they had. And it's so important, like I said, to understand why you're dealing with the symptoms you're having. And you find out that you have a hidden infection, that's a cause of these symptoms, or that's a cause of the underlying, of the thyroid disease that you have, or the thyroid dysfunction, because there are so many ways that your thyroid can be dysfunctional. And it helps us as practitioners know how to treat you. If we are able to do the right tests, we're able to know how to treat that. Uh, and we find, when we find out what you've got. I want to share a few patient examples with you. Maureen had headaches and brain fog and joint pains were some of her specific symptoms, not her only symptoms, but those were the main ones she was dealing with. She was found to have candida and Bartonella, um, and that were causing these problems. She certainly had some fatigue and so forth. And so as we were able to treat these symptoms, um, she was able to see improvement and major improvement in her symptoms. Um, Carrie was dealing with weight gain, hot flashes at night, migraines. Um, she was found to have Epstein-Barr virus reactivation, parasites, um, and I believe that was those were her main hidden infections. Um, Sandra was dealing with irritable bowel syndrome symptoms, fatigue, muscle aches, headaches. Uh, all of those went away when we were able to treat her, her gut infection that she had, parasites, um, and Epstein-Barr virus reactivation. Mark, one of my male patients, was having joint pains, fatigue, diabetes. He had H. pylori, parasites, and a gut bacteria infection, and he's been successful in reversing his disease and certainly feeling a lot better with better energy and no longer suffers from joint pains. So there you have a few examples. It's wonderful when we're able to find these causes, these infections. Now, I want to go through some of your questions. Um, okay, so thank you, Terry Ann, for listing those questions for me. The first one is, how do you test for parasites? And the the best well, there are no great tests for parasites. The best one to do is besides blood work, which gives us a lot of clues that there are certain parasites, um, would be stool testing. And even then, because it's like a one in in a thousand chance, that they'll come out with that particular bowel movement. Um, they're typically not great tests for parasites. There really aren't good, reliable tests for parasites. Even with um, like stool testing, and it's the most common way doctors do test for it, but it's just not very reliable. Um, there are other things to see in blood work, like I said, and we'll look at eosinophils, which is a type of your white blood cells that we'll see on a CBC. We'll check alkaline phosphatase, which is a liver enzyme. We'll check GGT, which is another liver enzyme that give us some clues. Okay. We often have to just couple that with the symptoms that you've had and where your symptoms are, and just dig a little deeper there. All right. And once you find them, how do you get rid of the parasites? So uh, again, there's no easy answer. You have to kill them. So that requires sometimes anti-parasitic herbs and anti-parasitic medications, but it also requires going through a process to prepare you to be able to detox from the die-off. Yes, your body has to remove the bodies. So that means there's cellular debris that has to be removed, even from your cells. So if your cells aren't healthy in the first place, it can be a real difficult proposition. It can take a long time. We have to get your cells healthy enough to where they can help you clear out the cellular debris into your lymph, into your, through your liver detox mechanisms and out through your feces, right? This is how we've got to get rid of them. Otherwise, you're going to be clearing them out through your skin and you'll develop rashes. That was another symptom that you can see with gut infections. You can get rashes, or with candida, you can get rashes. And I think most of you kind of knew that. Um, itchy rashes. And so, yeah, they're not easy. And sometimes it takes months and months to get rid of parasites. Okay. What is the CRP? CRP is short for C-reactive protein. It's a liver marker for inflammation, for systemic inflammation. And this tells us that your risk for heart disease is, if it's high, it tells us your risk for a sudden cardiac event is high. Okay, the whole respiratory thing, I've taken every allergy med they have, and I get no relief. I'm not sure I guess that's a statement, not a question, but yes, you need more testing. You need the right testing. You need comprehensive testing. So once we can do that, then we'll be able to have a roadmap for helping you and to help you have success with that. Can an endocrinologist check if I have infections? Well, if they knew about doing it, I suppose they could. If they knew what to do for them as well, I suppose they could. But between you and me, that's not their specialty. They're not looking for causes. They're not going to look for your root causes. Is shingles preventable? I mean, of course, there's a vaccine for it, and that is, one second. So we're talking about shingles. The vaccine is marginally helpful, but the main thing, ladies, is that you've got to strengthen your immune system and treat these infections, knock down the other stresses and strains on the immune system, so that these viruses, these herpes viruses, because shingles is one of the herpes viruses, and I'm glad you brought it up. It's that way it won't take hold and want to become more opportunistic, because that's the way it works. And it also seems to, when you get stressed, when there's different stress that you're under, and that comes in many forms, and I'll talk about that again more in the master class, but stress is probably the most common trigger for shingles. And so you need to do everything you can to decrease or to manage your stress, right? You need to practice relaxation techniques and learn how to do that. Next question, and I suppose it's the last one. Are there parasites in the blood? Well, there certainly can be. And one of the main ones is Babesia that can be in your blood. And there are others, but there certainly can be parasites in your blood. And one of the ones that might be more, maybe not as common, but more, something you might have heard more about, is malaria. And that would be a bloodborne parasite that goes to the liver and causes its causes its problems. So, all right, I think I have covered all your questions, and it's been an absolute pleasure. Just remember, we've got to uncover your root causes. So we do that by doing comprehensive testing. When you fix the root causes, your body can heal itself. So, ladies, have hope. There are answers, and remember that you still have the power to heal. Thanks for joining me tonight. Hope you have a wonderful evening, and I will see you soon. Take care.